This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 4th April 2025. The candidate's name is David Sundar Singh and the candidate number is 63421. The interlocutor is Roshni and the interlocutor number is 84192. This is roleplay number 1 for the profession of nursing. Good evening, David.
Good evening, ma'am.
May I see your identification, please?
Yeah, here it is.
Okay. This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally.
Sure, ma'am.
We will move on to a warm-up session to get you started. This is not in any way assessed. Okay, David, tell me, why did you choose nursing?
To be frank, the first thing I want to tell you is it is not my decision to go to nursing. First of all, my parents forced me to do that, so I entered into it. And after joining nursing, I felt like it was a good decision for me. I have seen so many, I have experienced so many things like which made me to feel this nursing field is a very good field.
Okay, great to know that. And can you describe any difficult day at work?
Yeah, to describe a difficult day, it has been what to tell. The days are not same like every day. We'll be having enjoyable day also, we'll be having like stressful day also. Whenever it is like usually shift starts from morning 7 to 6. If it goes beyond that, it will be like very stressful, and I have faced so many stressful days also.
Okay, David, that marks the end of the warm-up session. Now let's move on to the role play. I'll be taking the part of the patient or the bystander, and you take the professional role. The role play will last a total of 5 minutes, and you'll be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients.
Sure.
Do you have any questions?
No, ma'am.
Okay, so you'll have 3 minutes to prepare for the role play. Here is your role play. You can make notes on the role play card if you wish to do so. This is your pencil, and you can look at the card during the test, but you must return it to me at the end of the role play.
Sure.
Okay?
Sure, ma'am.
So you'll get 3 minutes of preparation time, and your preparation time starts now. Okay, David, that is the end of your preparation time. Do you have any questions?
No, ma'am.
Okay, then we shall move on to the role play. Let me start the timer. So your role play time starts now.
Good afternoon.
Good afternoon.
I am David Sundar Singh, one of the registered nurses working in this emergency department. May I know what brings you here?
Actually, I've come here with my daughter. She had a fall just a while ago while trying to climb a tree, and her head banged on the ground when she landed. I'm really worried.
Oh, I'm really sorry to hear that, and I can understand that you have been quite worrying for that. So, before going further, can you state your name, please?
You can call me Tina.
Okay, Miss Tina. For documentation purpose, can you please tell your daughter's name?
Anne.
Anne. And what's her age?
8.
She's 8. Okay, Miss Tina. To get a clear picture of what happened to your daughter, can you please tell me the exact scenario, what has happened to it?
Yeah, she was playing with her friends, and I could see her trying to climb on a tree.
Okay.
And it was at that point she fell. I think the height would be approximately a meter.
Okay.
And it happened an hour ago.
Okay.
And she landed on her left shoulder, but I think that shoulder is fine because
Okay.
she's still able to move that left shoulder. What worries me is that she also had her head hit on the ground. So I'm worried regarding that.
Okay, Miss Tina, I can really understand your concerns. And may I know further details regarding the fall?
Yeah, what else do you need to know?
So, can you remember on what surface she landed on? Whether she landed on a hard surface or smooth?
Oh, yeah, like she landed on grass, which was quite soft.
All right. Thankfully, it is a grass, but also
Yeah.
we have to be more cautious. So, for better understanding, can I ask some more questions?
Definitely, yes.
So, after you said she has fallen on a grass.
Yes.
So, after her fall, could you notice any signs of like dizziness, nausea, or loss of consciousness on her daughter?
Yes. She seemed dizzy just after the fall, but no other symptoms or any other effects weren't noticed from the fall so far.
Okay, Ms. Gina, thank you for letting me know. And I can really understand that she doesn't have any loss of consciousness or dizziness. I'm really happy for that. So, apart from this fall, does she have any medical issues or allergic to anything?
No, she does not have any other medical issues. She's not taking any medications. She has not done that so far, and as far as I know, like she's not allergic to anything.
Okay, Ms. Gina, I'm so glad to hear that. Okay. So, is this her first injury or she have been had a history of injury before?
No, she didn't have any injuries before.
Okay, Ms. Gina, thank you for letting me know. So, I'll be thank you for giving me all the information regarding your daughter.
Okay.
So,
fine.
next I'll be moving to the steps which we are going to do. Okay. Will that be okay for you?
Yes.
So, firstly, I'll be assessing your daughter's vital signs, like which includes like body temperature, like her weight and height. Will that be okay for you?
Yes.
And then, as you said, like your daughter has been fallen on a grass, facing on her head and shoulder. Yes. I'll be examining her shoulder and head. Will that be okay for you?
Yes.
So, I would like to tell you that based on the treatment and based on the assessment, I'll be prioritizing your child, like whether she needs a very urgent case or whether she can wait until the doctor comes.
Okay.
Will that be okay, Ms. Tina?
Yes.
And I wanted to tell you that the doctor will be coming and examining her, and based on the doctor's examination, he'll be telling you like what test should she has to undergo, or she requires furthermore treatment. The doctor will be the right person to tell you. Will that be okay for you, Ms. Tina?
Actually, I've heard what you said, but I feel that she needs a scan immediately, just in case there's any serious damage.
Okay, Ms. Tina, as a parent, I can really understand your concerns that you wanted to treat your daughter and you're so scared about it. Mm-hmm. I really understand that. But as of now, the doctor will be the right person to tell you, as I told you before, he will be the right person to tell you whether the scan is required or not.
Okay.
So, as of now, the right choice is that first I'll be assessing her vital signs, and I'll be examining her shoulder whether she has any further abrasions or like that.
Okay.
Will that be okay for you?
Okay, I understand.
And after that, I'll be telling the doctor that whatever I have assessed, and then I'll be taking the doctor to the doctor, and then he'll be the right person to tell you whether the scan is needed or not, and he'll be telling you what to do next. Will that be okay?
Okay, I understand why you say so. Okay, David, that marks the end of your speaking test. Please return the roleplay card to me. Thank you.
Thank you.
Medcity International Academy. Trusted hands forever.